The last time your body turned against you, you probably did something very ordinary. You opened a browser, you typed in the symptoms. Maybe you asked an AI why your throat felt like broken glass. Maybe you dug through a medicine cabinet, found a pill bottle, checked the label, and trusted that someone somewhere had already figured this out. Or maybe you did nothing dramatic at all. You lay on the couch for 3 days, sweating through a blanket, watching the same show you had already watched before, waiting for your body to stop being strange. But here is the part we forget. Even when you are scared, you still have a map. You have words: flu, infection, fever, migraine, food poisoning. You have numbers on a thermometer. You have doctors, pharmacies, search results, little plastic bottles full of human confidence. For most of human history, there was none of that. No diagnosis, no antibiotic, no emergency room, no clean explanation for why a healthy person could wake up shaking, burning, vomiting, and then simply fail. Just pain, just heat in the skin, just weakness spreading through the body, like a message nobody knew how to read. And that is the strange part. Humans did not vanish. They survived this confusion for thousands upon thousands of years. They carried children through it. They buried the ones who did not make it. They built camps, villages, temples, cities, kingdoms, while sickness kept arriving with no name and no visible face. So, what did they do? Not in theory, not in some neat textbook version of the past. What did a person actually do when there were no doctors, no medicine cabinet, no germ theory? No idea that invisible organisms were moving through water, blood, breath, and rot. The obvious answer is, they guessed. Chew this bitter leaf, press this root into the wound, burn this plant, and breathe the smoke. Call the healer. Pray, wait, hope the fever breaks before the person does. It sounds almost absurd from where we stand now. But then, the story refuses to behave, because archaeology keeps finding clues that these guesses were not always random. Ancient teeth hold chemical traces. Burials preserve bodies cared for long after injury. Clay tablets list remedies. Bones show healing. Tools, plants, scars, residues, graves, all of them whisper the same uncomfortable thing. Before medicine was science, it was attention. Before hospitals, there was memory. Before anyone knew what a microbe was, people were already watching sickness, testing the world, and passing down what seemed to keep death away for one more day. So to understand how humans dealt with illness, we have to go back far beyond white coats and pharmacies, back to a time when getting sick meant entering a dark room with no instructions. And somehow, generation after generation, we learned where to place our hands. You wake up with a fever, no bite mark, no broken bone, no claw wound, nothing dramatic enough to explain why your own skin suddenly feels too hot to belong to you. That is the strange part. To us, it is routine. You think virus, infection, maybe food poisoning, maybe something you touched on a bus and forgot about 5 minutes later. But for most of human history, that answer did not exist. Your body was quiet yesterday. Today it is shaking, sweating, vomiting, burning. No enemy is standing in the room. No animal is attacking you. No spear has gone in, and yet something is inside you, doing damage. So the obvious answer was not biology. The obvious answer was invasion. The Sumerians wrote about sickness as the work of demons, not as a metaphor, as a real force, a hostile presence that entered the body and had to be driven out. Ancient Egyptian medical texts could mix practical remedies with prayers, spells, and the idea that disease might be punishment from a god. Across continents, in societies that never met each other, people kept arriving at the same shape of explanation. The body was a container. Illness was something that got in. Healing meant getting it out. At first, that sounds like pure superstition. But then the story refuses to behave. Because the explanation was wrong. Yes, demons were not causing the fever. A god was not placing parasites in your blood. But the instinct underneath the belief was disturbingly close to what we would later learn. Something invisible really could enter you. Something unseen really could multiply inside you. Something tiny really could turn your own body into a battlefield. They did not have microscopes. They did not have germ theory. They did not have the words bacteria, virus, or parasite. They had smoke, chants, bitter plants, bone tools, hands on skin, and hope. Just chew this strange leaf. Breathe this smoke. Let the healer speak to the thing inside you. It sounds absurd now, until you remember the problem they were trying to solve. They were staring at invisible enemies without any way to see them. And the archaeological record keeps showing us that these were not random fools stumbling in the dark. Ancient medical tablets, Egyptian papyri, ritual objects, burial evidence, and healing spaces all point to the same uncomfortable truth. People were building systems around sickness long before they understood the mechanism. The earliest healers were not doctors in the modern white coat sense. They were translators. They stood between the suffering body and whatever the culture believed had attacked it. A demon, a curse, a god, a spirit, a hidden force with no face. And for nearly all of our existence as a species, that was the best explanation humans had. Not because they were stupid, because the real answer was too small to see. You feel pain today, and the first thing you do is simple. You look for help, a doctor, a pill, a scan, a clean room with lights too bright. That feels modern, but that is the strange part. The reflex is not modern at all. Long before hospitals, long before written prescriptions, long before anyone knew what a germ was, humans were already doing the one thing that kept us from vanishing. They were refusing to leave each other behind. Archaeological evidence pushes this back at least 40,000 years. Not in legends, not in myths, in bones. Burial sites from that deep past show people who had injuries that should have ended them. Crushed bones, missing limbs, severe disabilities. Bodies that could not have hunted properly. Bodies that may not even have moved properly. And yet the bones healed. That detail changes everything. A broken bone does not heal if the person dies right away. A missing limb does not become part of a long life by accident. Someone had to bring food, someone had to stand guard, someone had to help that person move, sleep, survive, and wait. No doctors, no medicine, no sterile tools. Just people looking at another wounded person and deciding, somehow, not yet. That is older than civilization, and then the story refuses to behave. Because the oldest known surgical procedure is not a bandage. It is not a splint. It is not some gentle leaf, chewed in panic while everyone hopes for the best. It is trepanation, a hole drilled into the skull. We have human skulls from around 10,000 years ago, with clean, deliberate openings cut through the bone, not random cracks, not damage after death, intentional holes, made by human hands, using stone tools on a living head. And here is the part that stops you cold. The bone healed around the edges. That means the person survived. So sit with that for a second. Someone, 10,000 years ago, looked at another human being in pain, took a stone tool, opened their skull, and that person lived long enough for the bone to begin growing back. We do not know exactly why they did it. The common theory is that they believed something harmful was trapped inside the head. A spirit, a pressure, a sickness with a face they could not see. So they made an opening and tried to let it out. It sounds brutal now, but beneath the fear, beneath the wrong explanation, the impulse is familiar. Something is wrong inside you. We do not understand it, but we are going to try. You get a headache today, and what do? You open a cabinet, you grab a pill, you swallow it with water, and go back to your life. Like this is normal. That is the strange part, because underneath that clean little tablet is a much older scene. No white coat, no pharmacy, no label on the bottle, just a sick human, a bitter strip of bark, and the terrifying logic of chew this weird plant and hope the body stops burning. And somehow, sometimes, it did. Not because they had neuroscience, not because they understood inflammation, microbes, or chemistry. They did not know what was inside the skull. They did not know what fever was doing in the blood. But humans have always had one brutal advantage. They keep trying. They try the leaf, they try the root, they try the smoke, the paste, the bark, the prayer, the cut into bone. Some of it was useless, some of it was dangerous, some of it probably killed people faster. But then the story refuses to behave, because mixed into all that fear and ritual was real observation. Quiet observation. Someone noticed that one plant made pain loosen its grip. Someone remembered that another helped a wound close. Someone saw a fever fall after a certain bark was chewed. And then someone told someone else. That is how medicine begins, before medicine has a name. Not in a laboratory, in memory, in repetition. In bodies surviving long enough to teach the next body what to avoid and what to try again. And we are not guessing about all of this from vibes and cave shadows. We have records, we have texts. Ancient Egyptian medical writings from around 1500 BCE specifically recommend willow bark. That matters because willow bark contains salicin, a compound your body can turn into salicylic acid. That is the ancient chemical ancestor of aspirin. So the thing in your bathroom cabinet is not as modern as it looks. It has plastic around it now. It has dosage instructions. It has a brand name, but the thread underneath is old. Very old, a human in pain, a tree by the water, a bitter cure discovered not all at once, but through generations of desperate, stubborn attention. It becomes salicylic acid. That is the quiet trick. The same active thing inside aspirin. They did not have chemistry. They did not have clinical trials. They did not have a white coat leaning over a microscope. They had pain. They had bark. They had someone saying, chew this, drink this, hold on until morning. And then the strange part happens. It worked often enough to survive, so they kept it. They repeated it. They handed it to children, to healers, to the next frightened person standing beside a fever bed. Thousands of years later, We pulled the compound out, named it, purified it, synthesized it, pressed it into a clean white tablet, and placed it under bright pharmacy lights across the planet. The packaging changed, the molecule did not. That is the vertigo. You walk into a modern pharmacy, pick up aspirin, and think you are holding something new. But part of that knowledge is older than writing, older than cities, maybe older than the idea of a doctor. And Willow is not alone. Turmeric, garlic, honey, ginger, echinacea. These were not just kitchen smells or strange roots in a bowl. They were memory systems. Human beings watched what happened. After a wound was packed with honey, they noticed which plants calmed swelling, which teas seemed to loosen a chest, which bitter leaves were worth keeping, and which ones were useless or worse. No one called it pharmacology, but the method was still there in its rough human form. Observe, remember, repeat, pass it on. A grandmother sees the swelling go down. A hunter survives the infection. A child's cough eases after the same root is boiled again. The village remembers. The story hardens into practice. Practice becomes tradition. Tradition waits, sometimes for centuries, until a laboratory finally catches up and says, yes, there is something inside this. But then the story refuses to behave, because not everything ancient people did was medicine. Some of it failed. The fever did not break. The plant did nothing. The smoke rose, the chant ended, and the body still burned. And that failure matters. It tells us something success cannot. When the leaf did not work, humans did not simply step back and accept the dark. They reached for another tool, older and stranger than chemistry. Ritual, repetition, community. They gathered around the sick person. They sang. They prayed, they kept watch through the night. They touched the forehead, they brought water. They made noise against fear. They made patterns when the body was chaos. Maybe the ceremony did not kill the infection. Maybe the chant did not change the blood. Maybe the spirits did not answer. But the sick person was not left alone. And that is not a small thing. Before hospitals, before nurses, before painkillers in plastic bottles, there was still this human refusal. You do not suffer by yourself. We sit beside you. We stay awake. We try the bark. We try the honey. We try the song. And if none of it works, we still remain. That is the ancient part still happening now. Not just the molecule in the tablet, the circle around the bed. And without knowing it, some of those strange little things were doing something real. Not magic, not just vibes. Not only panic in the dark. A hand on the shoulder can change the body. A group sitting around you can soften fear. The sense that someone is staying, that someone is watching. That help is not far away, can lower stress chemicals. It can dull pain. It can shift the body before the wound has even closed. That is the strange part. The obvious answer is, ancient people had no doctors, no pills, no machines, so they were helpless. Just chew the bitter leaf, press the hot stone, whisper over the fever, and hope the night is kind. But then the story refuses to behave, because some of those gestures worked. Not always, because the leaf was medicine, but because the body believed it was not abandoned. Today, we call part of this the placebo effect, and that word makes it sound fake. It is not fake. It is documented. It is measurable. It can be repeated in clinical settings. Belief does not replace medicine, but belief can still move biology. And humans found that lever long before they had a name for it, tens of thousands of years before hormone charts, brain scans, immune markers, or controlled trials. People were already building scenes that told the suffering body one message: you are not alone in this. The chant, the touch, the circle, the firelight, the elder leaning in close. These were not random decorations around healing. They were part of the mechanism. Sometimes the cure was a plant. Sometimes it was pressure on a wound. Sometimes it was heat, rest, water, bone setting, trial and error. And sometimes it was presence. A tribe gathering around a sick child was not just being kind. It was changing the child's inner weather. A ritual before a dangerous treatment was not just superstition. It was organizing fear into something the body could survive. Collective belief became an ancient technology. Emotional support became a tool no one had carved, no one had named, but everyone could feel. And that thread did not disappear. Modern medicine is astonishing. Antibiotics, surgery, vaccines, anesthesia, imaging machines that look inside you without cutting you open. Treatments so powerful, they would have looked like impossible sorcery to almost every generation before the 20th century. But even after all that metal, glass, data, and light, one ancient fact remains. The body still listens to the room. You can see it in the smallest modern scene. A doctor pulls up a chair, looks you in the eye, says your name like it matters. And somehow, even before the medicine has done anything, your body is already in a different story. That sounds soft. Almost too soft. But the research keeps being annoying about this. Patients who feel seen, heard, and genuinely cared for, often do better than patients, given the same treatment, in a colder room with a colder face, by someone already half out the door. Time matters, attention matters, not instead of medicine, not as magic, but as part of the mechanism. That is the strange part. Healing was never only the pill, the blade, the herb, the bandage. It was the circle around it, the hand on the shoulder, the person staying awake beside the fever, the ritual words, the bitter leaf chewed because nobody had a laboratory, no pharmacy, no clean explanation, just pain, fear, and the wild human need to try. And if you follow that need backward, it gets dizzying. For hundreds of thousands of years, people got sick. Without antibiotics, without scans, without anesthesia, without any neat chart telling them what was happening inside the body. Something invisible attacked. A child burned with fever. A hunter stopped breathing right. A wound turned black. The obvious answer was helplessness. But then, the story refuses to behave. They did not simply watch. They mixed plants. They called shamans. They made smoke. They cut, rapped, prayed, sang guest, failed, tried again. Some cures were useless, some were dangerous, some probably made everything worse. But buried under the error was the beginning of medicine. Not perfect knowledge, refusal, the refusal to accept that a person should die just because nobody understood the thing, killing them. That impulse is older than hospitals, older than textbooks, older than the word doctor. It is there in archaeological traces of cared for injuries, in bones that healed because someone fed the injured person, long after they stopped being useful, in graves where the sick were not thrown away, but kept within the human circle. So, when you sit in a clinic today and wonder why kindness changes the room, you are not looking at a modern extra. You are looking at one of the oldest tools we have. Look at today. You get a scratch. You wash it. Maybe you forget about it. You have a bad tooth. You book an appointment. You drink water, and you expect the water not to be alive. With things that want to use your body, that expectation is new. That is the strange part. For most of human history, there were no antibiotics, no vaccines, no hospitals waiting at the edge of town with white lights and clean sheets. A person could fall, tear the skin a little, and be gone a week later because the wound turned into a doorway. A toothache was not just pain, it could be a sentence. Childbirth was not just a family moment. It was a place where joy and terror stood in the same room. And water, the most ordinary thing. The thing you reach for without thinking. One wrong stream, one dirty well, one invisible colony inside it. And your body became a landscape for parasites, fever, disease. Measles did that. Smallpox did that. Cholera did that. The flu did that. Not as background noise, not as old textbook vocabulary. These things erased millions of lives. Again and again. While people still had to cook, bury children, carry wood, grind grain, and wake up the next morning. So when someone says early humans had no doctors, no medicine, just vibes and hope, it sounds like a joke. But then the story refuses to behave, because they did not just hope. They watched, they chewed the strange leaf, they burned the bitter root, they packed the wound with ash, honey, moss, clay. Some of it failed, some of it poisoned them, some of it worked just enough for someone to remember. And then someone else tried it again and again, across caves, fields, temples, sick beds, ships, villages, and cities. That is how a species fights an enemy it cannot even name. Humanity did not see bacteria until the 1670s, when Antony van Leeuwenhoek looked through a microscope and found tiny life moving, where no human eye had ever been able to follow. Before that moment, we had spent hundreds of thousands of years at war with invisible things. No face, no claws, no sound in the dark, just fever, swelling, rot thirst, coughing, and bodies failing, for reasons that seemed like curses. And still, people kept trying to heal each other, not because they understood everything, because they refused to accept that suffering was the final answer. That is the thread under all of this. Your clean cup, your stitched cut, your vaccine scar, your pharmacy shelf, your surviving childhood. They are not ordinary. They are archaeological layers of care, risk, mistake, memory, and stubborn human attention. So the next time modern life feels simple, look again. Someone, somewhere, long before you, had to look at a wound and not look away. Someone had to fail. Someone had to learn. Someone had to pass it on. And if generation after generation had not done that, if they had simply surrendered to the invisible world, then the real question is not how they survived. The real question is whether you would be here at all.